And something that we wanted to talk about is just the difficulty that providers have in being able to take a menstrual history. And just we wanted to talk to you a little bit about how you go about that and maybe just starting simply with how you define heavy menstrual bleeding.
Sure. Yeah. So it's really tough. So historically, they defined heavy menstrual bleeding as more than 80 milliliters per cycle, but clearly no one's measuring how much, right? I mean, now there are patients that are using menstrual cups. And so that can be nice because they can actually say, I fill my menstrual cup in this much time, which most of them, if you're filling it, that's a problem because they hold a lot. Now, ACOG and everybody who kind of talks about these things has changed that to really any heavy bleeding that affects like your physical, mental, any type of quality of life. But that also makes it challenging for a physician. So things that I typically get more concerned about are bleeding for more than 7 days, having to change products more than every couple of hours. I think the biggest piece of advice I have for people is just you have to ask so many detailed questions because we have a lot of adolescents who change their products all the time because it grosses them out to see the blood, right? So if there's any blood on the pad, they change it. Also asking, are you just using one product? Because I've had patients tell me like, oh, I can go 4 hours only to find out that they're using like double stacked pads plus a super tampon, plus period underwear or whatever. And so I think you just really need to get comfortable with asking a lot of questions. Other things that are concerning are the clots that are bigger than the size of a quarter. If you're having to change overnight, having accidents, or having a gushing sensation, which most people that have heavy bleeding, like the second you say that, they're like, yes. Whereas like people who don't, they're like gushing. Even with the time, like the amount of time someone's bleeding, I've had patients who say, oh, I only bleed for 4 days in a row, but then they only stop bleeding for 3 days and then they're bleeding again. Right. So, how many periods they're having in a month is also another question I ask. But I think it's unfortunate because society has stigmatized menstruation for all of human history, and it's still really stigmatized, and nobody talks about it. And the only one who's really aware of it, at least in pediatrics, is like the mom because she's buying the products. So sometimes she can say, "Oh, we're going through a lot of products," but especially in my field of bleeding disorders with inherited bleeding disorders, usually the mom's just like, "Yep, I had my uterus out when I was 22, and my daughter's having the same amount of bleeding I had. This is all very normal," when clearly it's not. And I have so many patients where I diagnose their daughter with a bleeding disorder, and then subsequently we diagnose the mom, who's had really awful periods that nobody recognized or nobody worked up.
One thing I was going to ask is if you use more open or closed ended questions.
Yeah, so I do start with open ended because I'm just kind of interested to know like what they think about their periods. And it really is fascinating because I would say at least half of the patients that I see who have really abnormal periods, if you just say, like, how are your periods? They'll say, fine, normal, like, I'm not concerned. And then those are the same patients who then you find out they bleed for 3 weeks at a time. And they just have no idea that that's not what's supposed to happen. And it's not surprising, right? We have some states where you can't even talk about periods in schools anymore. They did a big, really international survey a few years back, and like 41% of girls, parents of girls, never talk to their children about menstruation, right? So there are people who start their periods and no one ever even told them that was going to happen,
uh,
let alone what would be expected in terms of how much bleeding they're having. So I always start with open ended just to get a sense of what they think about it. And then I say, this is going to feel weird, but I just need to get a lot of information about how much you're bleeding. So I'm going to ask you a lot of questions. And then I ask more targeted questions.
Tricks you found to kind of communicate exactly what you're asking in an effective way to a population that may not be as used to talking about it?
I do try to make it more comfortable in saying, I talk about this all the time. This is going to feel weird to you, but it's just medical information that's going to help me take the best care of you. I think most of it is pretty straightforward. How often are you changing? What kind of products are you using? Are you using more than one product at a time? When you're changing at your heaviest, how often are you having to change that? But then if they're like, I change it every hour, then I say, and is that being soaked or for a different reason? And that's another question I ask is if they have accidents where it gets on their clothing or sheets at night or things like that. Because typically, like if you're soaking through something in an hour, at
Yeah.
some point you have
It's like
accident.